Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, neurological disorders are medically defined as disorders that affect the brain as well as the nerves found throughout the human body and the spinal cord. So, to discuss on various neurological problems, we have with us in studio Dr. N.K. Das, Director Neurosurgery Department, Health City Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Dr. Das, for coming to Good Life, the health show. So neurological problems, there are various neurological problems. So to start up with this, what would you like to tell our viewers?
For first of the neurological problem, we have the neurological system. The neurological system constitutes mainly three parts of the body. That we say the brain, spinal cord, and the nerves.
Brain, spinal cord, and the nerves. Okay.
So we can divide the problems related to the brains, number one, and number two related to the spinal cord, and number three the related to the nerves.
Okay.
So all this included the neurological problems. First of all, if you say the related to the brain, the most common neurological problem is the in social status is the headache.
Headache.
Almost all people you see, more than 90% people in the lifetime of period they are suffering from the headache. The headache may be many type of headache. It may be the migraine headache. Sometimes it's related to the hypertension. Sometimes it's related to the stroke. Sometimes it may be related to the disease, a lot of ischemic disease of the brain. Sometimes it's related to the infection. But most common cause is the migraine headache.
Migraine headache.
Migraine headache.
Right.
The other part we can say the spinal cord disorders. Basically nowadays we are using a lot of computer work, mobile work. To
sitting on the same position.
Sitting in the same positions and that our this is spinal cord disorder is very much common nowadays in the young age group. And most of that is in common term we can say is spondylitis.
Spondylitis.
The spondylitis is the common term for all type of spinal cord disorder. So cervical spondylitis basically the part in the neck we call the cervical spine. So any spondylitic disease occur in the cervical region that is called cervical spondylitis. And the other part is the lumbar. Lumbar is the back portion of our body.
Okay.
So we call it the lumbar spondylitis. So spondylitis is one of the common disorder nowadays. And initially, it is disorder usually seen up to after 60 years or 50 years of age. But due to the changing of the lifestyle in the modern era, we are using the mobile, laptop. So our body posture is totally changes.
There's balance and like nowadays we see mostly in the young people these kind of problems are seen in them.
So nowadays the young people start suffering from this type of disease.
Absolutely.
So we have to be very cautious about this because if the disease we usually see after 60, if we can able to detect at the age of 20, then definitely this is a real concern to the community as well as just person also. The other disorder we call this a nerve disorders, nerve basically. The nerve disorders, this is related to the as well as brain and spines. Nerve disorder, you can say some tumor is most common, some infection may be occur in the region, and sometimes it's associated with some injury also.
All right.
Sometimes you get the road traffic accident, sometimes the fall in the sleeping fall. So there may be some nerve injury. So that if that nerve injury occur, then there may be a problem in the movement of the limb as well as the hand, wrist, that type of symptoms.
All right, we'll come to that part, doctor. We have a caller waiting, so let's take the call first and then we'll proceed with the conversation. Hello.
Hi, namaskar. I Ganeshguri koichilu hospital.
Apnar prashno to koribo?
Mai thanda dinor nerve problem to beshi hoy niki moi janibo bicharichu doctor.
Okay. Thanda dinor nerve problem.
The temperature usually related to nerve problem. Mostly what happened during the cold season. অসমত ক'ব পৰা যায় না ঠাণ্ডা দিনত সাধাৰণতে আমাৰ মুভমেণ্টবিলাক বহুত কমি যায় দেখা যায় যে ঠাণ্ডা দিনত এটা নাৰ্ভৰ প্ৰব্লেম খুব বেছিকৈ দেখা পোৱা যায় সাধাৰণতে আমাৰ অসমত দেখা পাওঁ নৰ্থ ইষ্টাৰ্ণ ৰিজনত ছেপ্টেম্বৰ অক্টোবৰ নৱেম্বৰ ডিচেম্বৰ দেখা যায় ষ্ট্ৰোক সাধাৰণতে ষ্ট্ৰোক এই ৰিজনটোত আমি যদি ভাও নৱেম্বৰ ডিসেম্বৰ পৰা বেছিকে দেখা পোৱা যায় আৰু সাধাৰণতে another condition is called the spasm muscle spasm mostly we call as a medical term is a muscle spasm but বহুতে কমন ক্ষেত্ৰত কয় যে নাৰ্ভৰ প্ৰবলেম হৈছে নেকি সো টেম্পারেচার সাধাৰণতে ডাউন হোৱাৰ লগে লগে আমাৰ এক্টিভিটি বহুত কমি যায় সেইকাৰণে নাৰ্ভৰ প্ৰবলেম সাধাৰণতে সচৰাচৰ বেছিকে দেখা পোৱা যায় দ্যাটস ৰিলেটেড ওয়ান ইজ মই ক'লোৱে ষ্ট্ৰোক আৰু বাকিখিনি আৰু আছে স্পাজম ৰিলেটেড যিখিনি প্ৰবলেম সেইখিনি সাধাৰণতে ঠাণ্ডা দিনত বেছিকে দেখা পোৱা যায়
All right, so what could be the solution behind this? So you need to keep yourself warm, or what could be the problems to these
all the nerve related problem basically you see when there is a lack of activity because you see in the northeastern regions the sunshine in this winter season is daylight time is very less. So most of the time we have the night session is more. So people activity is very less. So regular exercise is very difficult to continue in this period. So to get away from this small nerve problem that I say is a backache, neck pain, lethargy, then we should go for the regular exercise. The regular exercise does not mean that we go for the gym, everything. So we can do it at home also. At home also. So I said at least 15 minutes walking. The walking should be like that. This is not a baby walking. We should walk fast.
Fast.
That means that the walking should produce little bit of sweat in your body. But it is difficult in the winter season. You are not able to sweat out completely. But if you sweat out, then your working is complete. That means that we call successful. That we call that is a effective working. Effective working. The other part is that you can go for the disease if you are not able to work. You can go to skipping also. This is a very good exercise. If you
All right, doctor, we have another caller. So let's take the call. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
মই মানে ঠাণ্ডা দিনত মোৰ এটা প্ৰবলেম এটা হয় আপোনাৰ মোৰ ভৰি কলাফুলৰ হীৰাটো কুচ খাই যায় আৰু খুব সিভিয়াৰ পেইন টাইপৰ হৈ যায় খুব কম টাইমৰ কাৰণে আৰু থাকিব নোৱাৰা হৈ যায় আৰু মই ডিসকাস কৰোঁতে কোনো মেডিচিন নাই বুলি কৈছে সেইটো কৈ থাকিব নেকি মোৰ
ওকে
ভৰিৰ যিটো তেখেতে ঠাণ্ডা দিনত কুচ খাই যায় বুলি কৈছে সেইটো মোষ্টলি মাসল স্পাজমৰ কাৰণে হৈছে চাগে আৰু মেডিচিন নাই বুলি ক'লেতো নহয় আজিকালিতো বহুত মেডিচিন ৰৈছে মানে কি আমি এটাৰ পিছত এটা ধৰণৰ মেডিচিন ট্ৰাই কৰিব পাৰো প্লাস along with the exercise also we can continue for that so মই ভাবো এজন যদি আপুনি ভাল নিউৰোলজিষ্টক বা দেখাই লয় তেতিয়া হলে we can treat him as a with a exercise and a medicine and definitely he will improve.
Okay. I'm sure the benefit you must have got with the answer just a doctor gave you, and thank you so much for calling to a Good Life, the health show, and keep calling because our numbers are flashed on your television screens, viewer. So if you have any problems or if you have any questions regarding neurological problems, we are having a fruitful discussion over here. So please call up on the numbers flashed on your television screens and ask your valuable questions. All right, doctor, coming back to you again, nerve problems we have seen, and also the problems which you have mentioned, it's been generally seen nowadays in the youngsters because of the lifestyle change, because of the lifestyle is not maintained, time management is not maintained. So what is the neurological problem which is commonly seen in Northeast? What would you like to say?
The Northeastern region most commonly pain basically start at joint pain as well as the cervical spondylitis is very common in northeastern regions and mostly if you see the total number of painkiller sell in the northeast is almost highest as compared to the other states because this is winter season lot of people going to the pharmacy and they take the medication without they have complained that we have got neck pain we have got shoulder pain so they have got arthritis another is a main problem and the maximum number of this painkiller is sell in the northeastern regions because the problem is increases during the time of winter. The winter season is I told you that is a lack of exercise number one thing and number two is our food habit also it is very important. So in the winter season, I think this is my personal perception that we should take more protein-based feed nowadays.
More protein.
What we take usually.
Okay.
Because to make our body warm like that.
But so this is the main reason to keep yourself warm.
Right.
So protein food is a must
Must,
in
right. Winters.
Okay.
So otherwise the vegetables and fruits part is little bit less in cases. So if we keep a balanced diet, it is very important for the neurological disease to prevent. Prevention
But
is
this
the
is
best.
actually because for restrictions for the people who have hypertension, and also because for them more protein food maybe hampers for them.
Right,
Isn't it?
right.
So it doesn't mean that doctor has mentioned that you have to have a protein, more protein in winters. That doesn't mean that you will have to have a more protein, but depends on your background, your medication, all your ailments as well.
Yeah.
If you have hypertension, so you have to have restrictions on certain things,
Right.
isn't it?
On diet basis, the proteins, number one thing, another component of the diet is the fat.
Fat.
We
All right,
should
we'll come on that,
yeah.
doctor, but we have another caller waiting for us. Hello.
Hello, মই আপোনালোকৰ চাই আছো মই সুধিব বিচাৰিছিলো সাধাৰণতে আমি দেখো জেনেৰেলি মানুহৰ এটা সময়ত মানে বয়স এটা হলে সাপোজ এতিয়াতো ডক্টৰে ক'লে যে ইয়াংগাৰ এজতো হয় কিন্তু মেক্সিমাম বুঢ়া হৈ গ'লে মানুহবোৰ লাইক আফটাৰ ৰিটায়াৰমেণ্ট মোৰ মাৰ যেনেকে নিউৰো কিছুমান প্ৰব্লেম পাৰ্টিকুলাৰ প্ৰব্লেম কিছুমান এৰাই লাইক হাত চাতবোৰ কঁপিব ধৰে মানে কিবা কিবি বেলেগ ধৰণৰ প্ৰব্লেম কিছুমান এৰাইছে এই প্ৰব্লেমবিলাক
Okay.
মানে নহ'বৰ কাৰণে আমি ইয়াং এজৰ পৰা কিবা প্ৰিকশ্যন ল'ব পাৰোঁ নেকি?
Okay. Shivering of hands.
Yeah. Retirement, there is a big problem, retirement actually. Post-retirement, lot of people suffer from this type of problem. Number one thing is that after retirement, they become jobless. সিহঁতৰ তেখেতসকলৰ কাম নাথাকা হৈ যায়, এক্টিভিটি বহুত কম হৈ যায়। যেতিয়া জব থকাৰ সময়ত হয় কি তেখেতসকল অফিচত যায়, কথা পাতে, that is psychologically and physically they are completely free actually. কিবা টেনশ্যন থাকিলেও ঘৰত থাকিলেও, বাট যেতিয়া এক্টিভিটি ছাডেনলি নাইকিয়া হৈ যায়, যিজন মানুহ হয়তো দিনটোত 8 ঘণ্টা অফিচত থাকে, তেওঁ 8 ঘণ্টা তেখেতে ঘৰত থাকিব লগা হৈছে, তো তেনেকুৱা স্থিতিত এনেধৰণৰ প্ৰব্লেমবিলাক দেখা যায়। সাধাৰণতে ৰিটায়াৰমেণ্ট প্ৰব্লেম বুলি আমি কওঁ, আৰু এইটো এজ ৰিলেটেড প্ৰব্লেম হয়, কিন্তু সেই প্ৰব্লেমটো হয়তো তেখেতে জব কৰি থকাত দেখা পোৱা নাছিলে, বাট ৰিটায়াৰ্ড হোৱাৰ পিছত যিহেতু তেখেতে ঘৰত থাকিব লগা হ'ল, লাহে লাহে এতিয়া আদাৰ প্ৰব্লেম চকুত বেছি পৰা হৈ যায়। তো সেইকাৰণে আমি ৰিটায়াৰমেণ্টৰ আগতে এটা কথা মনত ৰাখিব লাগে যে ৰিটায়াৰ্ডৰ পিছত তেখেতে সময়খিনি কেনেকৈ কটাব। দিছ ইজ এ ভেৰি ইম্পৰ্টেণ্ট পাৰ্ট অফ লাইফ।
What kind of routine you should follow?
Because আমাৰ লাইফৰ যিটো longevity it is increases nowadays. People is still now using more than 60, 70 years. We have encountered a lot of people more than 100 years also nowadays. তো লংগেভিটি তেখেতৰ পোষ্ট ৰিটায়াৰমেণ্ট 30 বছৰ সময় কেনেকৈ কটাব সেইটো প্লেন কৰি ল'ব লাগে। বহু ক্ষেত্ৰতো মই কওঁ যে ৰিটায়াৰমেণ্টৰ পিছত ছ'চিয়েলি আপুনি এক্টিভ হৈ যাওক। আমাৰ অসমত এতিয়া বহুত নামঘৰৰ কথা আছে, তেখেতে নামঘৰত যাব পাৰে। দেন হি অৰ চি শুড বি ছ'চিয়েলি এক্টিভ, নম্বৰ ওৱান থিং।
In this way or the other way?
Other way. And number two, আৰু তেখেতৰ যিটো ৰেগুলাৰ এক্সাৰচাইজ, তেখেতে সেই ৰেগুলাৰ এক্সাৰচাইজৰ পৰিমাণটো বঢ়াই দিব পাৰে। আগতে যদি তেখেতে অফিচৰ কাৰণে 1 ঘণ্টা কৰিব নোৱাৰিছিলে বা তেখেত ষ্টাৰ্ট কৰাও নাছিলে, এটলিষ্ট post-retirement, he or she can use this time for his health. তো তেতিয়া আমি সেইটো প্ৰিভেনশ্যন কৰিব পৰা যাব। এবাৰ যদি তেখেতে সেই ভাবে যে মই নিজকে ফিট ৰাখিব লাগিব, মই এক্সাৰচাইজ কৰিব লাগিব, আৰু মোৰ যিহেতু এতিয়া অফিচ নাই, মোৰ হাতত অজস্ৰ সময় আছে, তো যেতিয়া তেখেতে ভাবিব যে মই দেহৰ কাৰণে কৰিম, I will work out for this time for health.
And this encouragement could be given from the family members as well, and they will be a part and parcel of his encouragement and his scheduling of time as well, isn't it? As a doctor, we will again have a conversation on more things, but a nerve problem which you were talking about, and what are the most common problems which is found in Northeast, and you mentioned about pain. So pain is one kind of, it can be a headache also, and generally we see headache, many kinds of headaches. So how a person will come to know that this headache is a serious kind of thing, or is it the normal headache?
Normal headache. The most common type of headache I told you that this is a migraine type of headache. But people when suffering from a headache, they usually is anxious. They scared also. Sometimes the headache is going on day-to-day life basis, keeping on. They say that maybe brain tumor too. It's
And
maybe
migraine
brain
can be
tumor
of many
also.
types as well. Migraine can be
mild, moderate, severe. So I want to confuse the confusion between the brain, this is headache arises from the brain tumor, and the migraine headache is very simple to differentiate. If the person is suffering from the headache from the brain tumor, so what happened, along with the brain headache, he will get other problems. Most probably he will getting difficulty in vision, he will develop some weakness in the body.
Okay.
He will, there will be severity increases day by day. Suppose today you have the headache for a brain, if it is a brain tumor, if it is a headache today, it may be 1 hour, but next day it will be 1.5 hours, next day 3 hours.
So the time frame will increase.
Time frame will increase.
Okay.
The other problem, it is associated, suppose unconsciousness. Headache, they may be associated with the unconsciousness. So if such symptoms occur, the unconsciousness, there's a weakness of any part of the body, if he has difficulty in hearing, if he has difficulty in looking something, then that is associated with
So
the
if
brain
any
tumor.
similar kind of symptoms is being seen, which you
Yeah.
have mentioned at this point in time, so you should, to clear
Yeah.
out your confusion, so
Right.
immediately go and see a neurologist, isn't it?
Neurologist.
Okay.
The-
Doctor, we'll talk more on
Yeah.
this, but we have to slip into a short break.
Yeah.
All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the Health Show with me, Puja, and we are having a fruitful discussion on neurological problems. So, Doctor, coming back to you again, we were having a discussion on migraine, on headache. So, how would one person differ that this is a brain tumor pain or something
Migraine
like
pain.
Migraine pain.
The most common cause of headache is the migraine pain.
Migraine
pain is usually seen in the one side of the head, but it may be both sides also.
Okay. Usually it's seen in one side.
One side it is most commonly, but it is associated with vomiting. And mostly this is associated with anxiety also.
Okay.
Some people say that this is maybe the tension headache, whole office work, stress
tension,
related.
okay.
So migraine headache usually subsided with medicine only. And number two, if you take the good sleep also, that is another reason, then that pain will subside. And that pain is usually not increases just like a brain tumor day by day. It is not associated with any problem with just like a weakness of the body, that the difficulty in vision is not associated. And mostly the eye-related problem associated with the migraine. So when you suffer from headache repeatedly associated with vomiting, the first of all we should check up the eyes. Some refractory error of the eyes is one of the cause of the headache. This is very irritating when our students mostly, when they study during the time of exam period, they have more stressful life.
More stress.
So we encounter with this type of headache. And if any confusion is there, then we can go for the one type of investigation by CT scan or MRI brain. Then we can rule out that there is nothing inside the brain, because in migraine headache, all investigation comes normal.
Normal. Okay.
Normal. So,
and if the symptoms which you mentioned for brain tumors, so if any similar kind of symptoms is seen, so for that also, what kind of investigation is being done?
The best investigation for the brain is the MRI.
MRI.
You get a magnetic resonance imaging, so we can see all parts of the brain. Maybe any abnormality part of the brain is there. So for the investigation purpose, we do the MRI. MRI there is no side effect also. They're not like a CT scan.
Yeah, that also is being pointed out by some of the attendants as well, or some of the patients as well. So might be because of the ray, or might be because that might hamper to other parts of your body. So those confusions also should be cleared up.
The CT scan is associated with radiation because it's based on the radiation. Principles. So CT scan usually we do in case of head injury, when there is a immediate report is required, because the MRI investigation takes little bit time. It may be 30 to 45 minutes. But details investigation of the brain can be given. And there is no side effect, because the principle of the MRI is totally different. If we do repeatedly also, no hamper. Even during the time of pregnancy also, in some country, this is congenital disorder of the brain, we can go for the MRI.
Women are not allowed to go inside the machine.
And set the CT scan machine, but MRI is safe. MRI, you can say it is safe as a ultrasonography. So that's why there is no side effect of MRI. So any type of problem related to the brain and spine, we can
that can be cleared out by MRI test.
Cleared out by MRI without any restriction to any age group. Any age group.
So after when it is detected, if it is a normal migraine, so that can be easily cured. But if it is related to brain tumor, then what you do is where you find out the stage and then the treatment starts. Okay.
So if you go for the brain tumors, then as I am a neurosurgeon style, I love to talk about the brain tumors.
Absolutely.
Because I do operation regularly on the brain tumors. So brain tumors, when
It's
you
indeed
go for,
challenging for you,
Yes,
actually.
right.
And like, if I need to ask you personally, that how many
Right.
surgeries you have done so far, so that would be a very like a challenging and an initiative that has done to be a part of the society
Right.
as well.
So when I come to, I was actually, my education was outside the Assam. I did MS from PGI Chandigarh, then super specialist from SGPGI Lucknow. I passed out from 2007.
Okay.
Then I joined as 2000, I come back to Guwahati. And from 2007, I doing the professional neurosurgery. And from 2018 onwards, I was in Health City Hospital.
Okay.
And almost 18, 11 to 20, it is 13 years, I have crossed almost 6,000 brain surgery, including spine also,
Okay.
in the northeastern regions. So I have, specially I do some specific surgery for brain also, all complicated surgery. Though initially we problem one, this is infrastructure.
Infrastructure.
Because all complicated brain surgery, usually I have to send you, but most of the people in the northeast, they are planning to send outside from the northeast, or especially from Guwahati. So we have equipped all type of microscope. We have the neuro navigation.
And
That means,
actually, things have also advanced, infrastructure has advanced, the technicals have advanced. So it has become a bit easy also,
Right.
which was not in the past.
Not in the
Doctor, we
past.
have a caller waiting, so
Yeah.
let's take the call. Hello? Hello? All right, the phone got disconnected. Okay, let's proceed with the conversation.
the infrastructure, we have got the microscope. This is the most upgraded microscope is available in our health city hospitals. And number two is neuro navigation, which medically we say the neuro navigation, but in the common language we call it computer guided brain surgery. So that facility also available nowadays. Though
Okay.
if suppose this brain tumor is there inside the brain, so we have to take the help of the computer. The computer will guide you that you have
Okay.
to go this way, and we can operate safely. Nowadays, one surgery sometimes we can do. This is called aortic craniotomy also. The aortic craniotomy means patient may be awake during the time of surgery also.
Awake, okay.
Yeah, so
Okay.
that type of surgery is already started in the northeastern regions. So all type of upgraded
That's
neurosurgery.
very scary, actually.
Yeah, this is very scary.
Very
If
scary
you-
and also very challenging as
very
well.
challenging. I think you have got a lot of news also. There's some people is using they're playing the guitar. The surgeon is operating on his head.
Yes.
So that facility also available here because the computer navigation system we are available at present.
It's just because done because of the peace of mind the patient would
Yeah.
be and the environment. If the environment is good, then the patient might not get that scared,
Right.
Which is initially being done, isn't
Right.
it? Okay.
The other reason is that because if you can operate during the time of aortic craniotomy, the patient will tell you that I have developed some weakness in my limb, so surgeon will stop to operate at this level.
Okay.
So that is the other advantage. That's why you can prevent the complication. The patient will say, no, sir, I am not able to move my hand. But if we do the operation under anesthesia completely,
Then
you
you don't
know
have any symptoms
Any
to know that
symptoms to
is the things working or not. But that,
Yeah.
at that point in time, he or you are having a conversation,
Right.
isn't it?
Yeah, the patient will tell you definitely, even the operation also, that he will tell you, sir, I am not able to move my hand, so you should stop the surgery at that point.
Okay.
So that is a very interesting type of field. And another surgery, especially I do in the northeastern regions, that is called the stroke. Basically in Assam, stroke is very common, and especially another stroke in children. So this-
Stroke in children.
Stroke in children. I have
Okay.
doing the research on this field also. And we have detected lot of cases stroke in children. One of the cause this disease is called
Doctor,
Moya disease.
we have again the caller joined to us.
Yeah.
Hello.
हाँ मैडम बोलिए
हेलो जी हम सुन रहे हैं, आप अपना प्रश्न कीजिए.
हाँ अरुणाचल से बोल रहे हैं
जी बोलिए आप अपना क्वेश्चन कीजिए और टीवी का वॉल्यूम थोड़ा कमा लीजिए, तब क्वेश्चन हम सुनने में.
प्रेशर पेशेंट है हम जो स्ट्रोक होके बैठा हुआ है थोड़ा जानना चाहता हूँ उसको क्या करना है
ओके, आपको स्ट्रोक हुआ है. ओके, यू प्लीज हैव अ कन्वर्सेशन.
अच्छा,
जी लेफ्ट साइड
he has got stroke basically. I think
You can have a conversation with the person. He's online.
he is stroke आपका कब हुआ था?
2015
इसी साल का हुआ था आपका? I think he is suffering from the stroke. At present, acute type of treatment is not required. At present, he required a rehabilitation therapy and medication only.
Okay.
So if
He's
he,
online, you
yeah,
can ask
he's so you can come to any neurological institute. Then we can give advice regarding the rehabilitation of the stroke therapy.
All right. All right. Thank you so much for calling from Arunachal Pradesh. And Doctor, indeed, we have to stop this conversation at this point in time. We have really short of time, but we will like to continue with the conversations ahead in our next episode. So thank you so much for calling and
So we
giving us...
have finished the stroke in children. So next episode we will continue from the stroke in children.
Absolutely. We will try and finish all the problems, neurological problems in our next episode. But right now with this, we have come to the end of the show. And we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.